My name is Dr. Rachel Cady. I'm an obstetrician gynecologist and I work at Cady Regional Medical Center. I've worked here for about 16 years. We know that low libido is a very common concern for women all ages, and a lot of times women will come in having just concerns about they just don't have the desire that they used to have. They don't understand why. Again, this is not a older woman's issue. A lot of times it's young women, again, really just can affect somebody regardless of their age. But the important thing is that when somebody comes in with low libido, you really want to get a basic history. You know, what have they noticed? What's sort of been their timeline? Obviously asking about relationship concerns, those kind of things. I think that just getting a general history, just like you would for any consult, because the causes of low libido are many. Again, situational is certainly one. If somebody has a partner that they're struggling with their relationship on, that's oftentimes a concern, but not always. And so for a lot of these women, they're like, I still love my partner. I just don't know why I don't feel that normal desire or arousal or orgasm or whatever their concern may be. Most commonly, it's more of an issue with desire. And so it's really getting a history from them. Are they on any new medications? Some medications actually alter the neurotransmitters in our brain that affect our libido. There's an area in our brain, it's called the prefrontal cortex, and that's sort of our sexual desire center. And so we know by altering some of those neurotransmitters that actually affects somebody's libido, for example. There's a whole list of medications with that, most commonly, especially in younger women, it can be different antidepressants and things. So sometimes it's simply looking at their medications, a timeline, and seeing if there's anything that can be changed that way. But that is not always the case. For premenopausal women, interestingly, there's now 2 FDA-approved medications for low libido. Again, this is low desire, no obvious cause. It's causing them some distress. They're upset about it. A lot of times it's impacting their relationship. They want to really be proactive. And again, these 2 medications, one's called Cady and one's called Vyleesi. These are for premenopausal women, and that's very new. These are very helpful to a lot of women. The other things too that we know help with low libido is cognitive behavioral therapy and certainly sex therapy as well. Now, fortunately, we have avenues to offer that to patients at Cady Regional Medical Center. You also want to obviously ask during a history if there's any issues with pain, those kind of things, because a lot of times women will have low libido because something hurts. And then you don't want to, it's hard to have much of a desire for doing anything if it's going to cause you pain. So you really want to get that history as well. But assuming that that's not the issue, that's when we really focus on, at some consults we'll actually get some hormonal testing, but more commonly than not, really intervening for those patients as far as making any medication alterations, considering some cognitive behavioral therapy, offering medications like Cady or Vyleesi that are for low desire, and close follow-up with those patients. I should say too, also establishing what their goals would be and really reassuring them that this is a common problem, and to remove that guilt. This isn't a mind over matter. A lot of times it's establishing what could possibly be the cause of this, and sometimes it is very much an organic biologic cause. Again, we were talking about neurotransmitter issues with that prefrontal cortex, really addressing that. There's also some antidepressants that actually work to help libido, one of which is bupropion. Again, it goes back to how it affects that sexual center in our brain, that prefrontal cortex. So a great reason to come in to your gynecologist to know that it's not an uncommon problem. It affects most women at some point in their life. The highest incidence is in those perimenopausal, early menopausal women, but this is not an older person problem necessarily. There's actually a really good process of care, just like there is for postmenopausal women, there's also one for premenopausal women. And so it shouldn't be a long drawn out process really at all, that there's actually very much a standardized care pathway for premenopausal women as well, where you're getting their history, you're evaluating for pain, you're making sure that there's no medications that are causing low libido. And then you're being proactive at trying to use those medications and that are approved for low libido, and they're safe, well tolerated, but also taking advantage of things that we know help with libido concerns, and again, that cognitive behavioral therapy, and in some situations, sex therapy as well. Call our OBGYN clinic and we can make that appointment. They do not need a consult from their primary care clinician. So typically it's about 45 minutes to an hour. Yeah, and we try to prepare for that visit as much as possible by getting records and in some cases sending some questionnaires ahead of time to the patient.